Hey, welcome, welcome. Thank you for being here. It's Q&A Tuesday. I'm Bridget Factor. I'm a certified nutritional therapy practitioner. I'm also a registered yoga teacher, and I am here to answer your questions. So I am glad you're here. Thank you for being here. A quick disclaimer, the information presented during this video is for educational purposes only, and if you are dealing with a medical condition, you need to seek the advice of a licensed medical provider. Okay, thank you again for being here. So today's question comes from Kenya. Thank you for asking a question, and she wants to know, can low-carb diets enhance or increase anxiety and panic attacks? And this is an excellent question. So I've talked before about low-carb dieting, and I've also talked before about kind of how to determine the amount of carbohydrates that would be good for you in your diet and how to dial that in. So I've addressed these questions before, but to answer her question specifically about how, if a low carb diet can increase anxiety and panic attacks, the short answer is yes. And so I kind of want to talk about that because it doesn't mean that happens for everybody. I am a strong believer in biochemical individuality. So that means each person is unique. They have their unique genetic predispositions, and they have lifestyle and diet influences on those genetics, which can determine how those predispositions are expressed. So in other words, everybody's unique, and there is no one size fits all diet or explanation or cure for anything. So let's kind of talk about anxiety and discuss first what the symptoms are. So you kind of know what anxiety is, the feeling of nervousness or anxiousness. Sometimes that's completely normal. Sometimes it can overtake your daily function in life and how you interact with other people or your family. And if you tend to be really stressed or get overwhelmed easily, on edge, social anxiety is another thing entirely, where you just don't like, or you're uncomfortable around large people or large crowds of people, and that can make you nervous. So I understand social anxiety because I have a little bit of that as well. And there are different things that can contribute to feeling anxious or having panic attacks. And it's not all in your head. That's what I think some people have a misunderstanding about, or the stigma that's out there is that it's all in your head and that you can control it completely. That's not true. There can be physiological reasons people struggle with anxiety. So the way I approach this is I want to try to figure out what are those underlying reasons people are struggling. And, of course, I truly believe that food can be medicine, and so I start there. Sometimes a lot of our population has blood sugar imbalances, so they have these blood sugar highs and these blood sugar lows, and that can actually affect your behavior. What happens when you have these highs and lows, it actually causes a stress response in your body, and that stress response then produces cortisol, which is produced by the adrenal glands, and that can have an effect on your behavior or how you view the world. If you're in a chronic stress response, whether it's diet related or emotionally, mentally related, that can affect how you kind of interpret your surroundings, and it can exacerbate your anxiety. So we've kind of talked about, I just mentioned adrenal glands, those that regulate your fight or flight response. People can have adrenal dysfunction. They can either have elevated levels of cortisol, or they can get to the point where their adrenals can't keep up with the demands on them and have low levels of cortisol. And both of those can affect your mood. That can in turn affect how well your thyroid is functioning. So thyroid can definitely play a role in whether someone is experiencing anxiety or panic attacks. And those two, I look at those two as linked because they communicate, and if there's a dysfunction in one, there can be dysfunction in the other. So looking at those together is very important. Other things that can contribute to anxiety are just simple nutrition deficiencies like B vitamins and zinc and minerals and fatty acids. If you are deficient in some of these, that can actually contribute to that feeling of anxiousness. So those are things to look into if you're dealing with that as well. So diet is hugely important because it sets the foundation for the way our body functions, but there can also be things going on outside of that as well. So your belief system and how you interpret your surroundings triggers certain biochemical cascades in the body that can then communicate with your gut, communicate with the rest of your body on how you're feeling. So we want to kind of look at this from both directions. We want to look at what's going on inside the body and then how that affects our thinking. We also want to look about how our thinking affects what's going inside our body biochemically. So we need to address this from both directions. And, this can be where you get some therapy, where you get plugged in with a religious community that can really help you support that, where, daily prayer and meditation can also help with that as well. So I really truly believe in looking at it from both directions, and get to the root issue. If you're experiencing anxiety, what is it? Is it a nutrition deficiency? Is it a blood sugar issue? Is it a thyroid issue? Do you have some kind of infection going on that could be adding to your stress load? Those are all great questions to ask to get to this issue. So I appreciate you guys being here. I have lots of people watching. Thank you. So Louise is asking, are there simple tests to determine where you are deficient? You can do a standard blood chemistry lab, and you can kind of infer from that different deficiencies. There's also another test called SpectraCell, which is a micronutrient analysis, and it specifically looks at vitamin and mineral and fatty acid deficiencies. So there are tests out there that someone trained to look at them from a functional perspective can determine if you're dealing with certain deficiencies. Absolutely. Thank you for that question. All right. So let's continue this conversation in our Facebook group. Post a question. I'll be on and off and try to answer those questions as well. If you're not in our Facebook group, the Restorative Wellness Community, please ask to join, and let's continue this conversation. Oh, Louise has another question. What about inflammation in your body? Okay, so you can, from a standard blood chemistry panel, you can look at different inflammatory markers to see if there is inflammation, and then through an assessment, we can kind of key in on what might be contributing to that. And so the first step is to get on an anti-inflammatory diet, so removing sugars and refined flours and fats that like omega-6 fats and oxidized fats, those kind of things. But it does take a little digging to specifically pinpoint what is causing that inflammation. But all right, okay. So I just want to thank you again for being here. Absolutely continue this conversation in our Facebook group. And until next time, grace and peace, and we'll see you next week.